My name is Tonya, and recently I had a mastectomy due to breast cancer. Mastectomy was done by Dr. Rachel Gendro, and my plastic surgeon was Dr. Mitchell Henry. Care treatment with Dr. Gendro and team was phenomenal. The first thing that happened was that there was a really friendly face that met me when I came into the waiting room. Brought me in to see Dr. Gendro. She took me, and Joanna, the nurse navigator, took me into a room and explained everything to me. So they explained my results to me, talked about options for procedures to me for to remove the tumor. And then we started on the process then of next steps, which was an MRI. The entire staff of Dr. Gendro's, nurses, right, the administrative staff, making sure I understood what my choices were, what time I should be someplace, what had been done, what hadn't been done, like walked me through the entire process. And she's like, here are your choices, here's what's going on, tell me what you're thinking and feeling. And so we walked through it, and I actually asked her at that time, I said, Dr. Gendro, if this was you, what would you do? She goes, I do not want to influence your decision because this is your decision, Tonya. And she goes, and nobody should be making decisions for you. So first of all, absolutely best advice ever by a physician. It is your care plan, right? You are in control. And the other part that was really fantastic was during the discussion with Dr. Gendro when we made my decision about the mastectomy was, okay, she had listened to what I wanted as far as a next step, right, in the process, and sent me to a plastic surgeon that she felt very confident in, which was Dr. Mitchell Henry. And that experience exceeded my expectations too. There was a bridge. They actually understood what was said over here by Dr. Gendro's team, right? They still had questions for me, so they were prepared for me, and then they made sure that they set enough time up for me to ask my questions, which was really, really important. The other thing that was really unexpected for me was the social services. So they had a social worker that called to check on me, and I think that is a missing link, and I'm so glad that that resource is available. But it's really invaluable for women to know it's not a time to hide. Putting yourself in really healthy environments where you have a strong social support network is vitally important. And I know many women don't have that at home already. I just feel that we need more of that. I don't know what that looks like. And if we internally, as some of the survivors, need to help support that, you know, if it's a grassroots efforts, I don't know, but that's really vital. I honestly had the best experience, and I was incredibly scared. The amazing staff really was just emotionally supportive. I'm almost going to cry. Emotionally supportive, as well as physically supportive, right? Giving me all the resources, but really, really was concerned about me as a whole person. The thing that Dr. Gendro said to me on the phone was, we are going to take such good care of you. And I knew the minute she said it, I was going to be okay. And that's exactly what happened. They did. There wasn't a time that I didn't feel taken care of.